Thank you very much again, Nikki and Ria, for organizing this meeting and having the Afghanistan team as well. So we trust to learn more from the MAMI group members and having a private exchange on the flow of this meeting over the presentation that's to be delivered by our Save the Children colleagues. As this group exchange or mainly focus on the mother and infant health and well-being and prevention. So we're eager to hear more new path of carrying of mother and infants, particularly in the current situation of the Afghanistan. As you know, in the current situation of Afghanistan is very hard, particularly for the women, even though they don't have the primary access to their rights. So that's why we have many problem and also many difficulty, particularly the issue of the access of the women to their primary health care or their rights. So and it's so in the current situation of Afghanistan, fortunately, we have one of our partners, that Save the Children, are maybe presenting their presentation, and they will wrap up all the situation, maybe the achievement of the MAMI services, the challenge, the barrier they faced, because as you know, the MAMI services implementing in Afghanistan for many years, but under the umbrella of the integrated management of acute malnutrition, don't as a separate services. So this is just for a few years. This is implemented as a separate services in few of our premises where they Save the Children operating, like Balkh, Kandahar, maybe so other premises. So if you look at the data of the mothers, particularly the PBWs, and also the infant under 6 months. So for 3 consecutive years, we have more than 1 million PBWs. Those are affected by the wasting and the reach out of the services. And also we have admission of the around 40,000 children under 6 months inside the TFUs, or maybe we call it IPD some services. So that's all the reason, that's all leading by the low education level, low awareness of the mother, how to take care of the child, how to take care of yourself due to the current situation and so on. So maybe there's a lot of things, there's a lot of problems that we would like to share with you, but looking to the time of your groups, you're dedicated. So I would like to hand over the floor back to you, and thank you so much for having the Afghanistan team, and be looking forward to your more and more valuable advices, and very pleasure to having you and having more and more coordination with you. Thank you so much. Over from my side.
Thank you, Dr. Sanga, for those very clear words, and really it sets the scene for what you're working on and the situation. We really appreciate that. Thank you very much. I hope, will you be able to stay with us for the meeting in case there are questions, or yes? Okay. Without further ado, I pass to Dr. Malik from the Health and Nutrition Manager from Save the Children, who is going to be explaining the program. So welcome, Dr. Malik.
Thank you so much. Thank you so much. Good morning. Good afternoon, everyone. I'm Dr. Malik Fath Sediqee, Health Nutrition Manager at Save the Children, Afghanistan. Today, I am pleased to share our experience on implementing the MAMI approach in Afghanistan, especially today's focus in Balkh province. This part of our broad effort to protect most vulnerable infants under 6 months and their mothers through earlier intervention and integrated care. So we'll go to slides. I will discuss more on slides regarding our experience and how we did it. Thank you. Let me zoom the slide. I think I can. I'm not able to see full the slide. I think it's a little bit zoomed.
One second, Dr. Malik. Let me try and share again.
Okay.
Can you see that okay?
Let me, yeah. Maybe I'm new in Zoom platform. Sorry for that. Thank you so much. Our team at Save the Children has implementing health nutrition programs across these 9 provinces in Afghanistan. Our approach includes static health facilities, mobile health nutrition teams, outreach, and therapeutic feeding centers, which reproductive, maternal, and neonatal health, ANC, PNC, and TT immunization is included in these interventions. Immunization and growth monitoring for the children, infant and young child feeding services, and also screening for malnutrition and treatment of malnutrition, providing psychosocial support counseling for individuals, and also hygiene promotion sessions and soft component of wash, plus somehow hard component of wash to through our health facilities. And our health facilities are integrated with other sectors as well, like we are integrated with child protection and wash as well, and we are providing primary essential health services and nutrition services through our this approach. Next slide. Thank you. As I said, we picked Balkh province for this presentation. I should say that we have implemented MAMI approach through all 9 provinces of Afghanistan through BHA funded project. So today we'll speak about Balkh province. First of all, you should know the Balkh province context. It's a northern region of the country, and in Balkh, this province, we have implemented this MAMI approach to 2 districts, Dawlatabad and Charkan districts, which was prone to drought and harsh winter conditions. And the health nutrition landscape was like gum rate in children under 5, it's 15.4%. SAM rate in children under 5, it's 3.9%. PLW with acute malnutrition, 25.6% percentage of PLW is acute malnutrition, and the exclusive breastfeeding is 60%, and also the basic vaccination in children under 12 months is 43.5%. This was the landscape of the Balkh context, Balkh province context, as it's not most different with other provinces as well. So we started implementing MAMI in Balkh province. Next slide. It is the timeline for our the January of MAMI program in Afghanistan for Save the Children. In 2020, Save the Children deployment to nutrition cluster to adapt the MAMI care pathway for Afghanistan context. We have presented the MAMI approach to nutrition cluster and also to Ministry of Public Health, especially Department of Public Nutrition. In 2021, training for Save the Children staff on MAMI facilitated by our MAMI advisor, first remotely by Alice Borrell and our other technical advisor. In 2021, also Save the Children started pilot implementation of MAMI integrated with their BHA supported health facilities. We started this approach through BHA funded health facilities in 2021 till now, 2025. In 2022, during this period, MAMI refresher training conducted for our supervisors in person, facilitated by our global technical advisors, MAMI advisor. In 2025, still we are implementing MAMI in, in Balkh province and also in other provinces. We are implementing in 2 sites in Balkh, and we are planning to expand for all health facilities in all of our health facility across the country, which were active on that areas. We will expand this program to this approach to our health facilities. Next. Yeah, you can see here the adapted MAMI care pathway, which I will briefly explain this, that all infant children which is visiting our health facility will receive a rapid screening, like MNCI danger signs, anthropometrics, breastfeeding assessment, and any other challenges, and plus MAMI assessment, which is conducting by our nutrition nurse. After that assessment, we are going to classify that children in 4 categorized: no nutrition risk, with if the weight for length is bigger than -3, it will be disaggregated. It will be categorized and enrolled in preventive MAMI. And if it is less than -3, will categorized as a OPD SAM, outpatient SAM. And if this weight for length was less than 3 plus complications, we will refer to inpatient SAM care. This was this overall the pathways of this MAMI care pathway in our health facilities routine for infant children. Yeah, next slide. The adapted MAMI care pathways, we are categorizing under 3 pathways of care pathways. Like, if the infant assessment outcomes met the IPD SAM criteria for that infant, we'll refer to the IPD SAM. If it, the output of that assessments met the OPD SAM criteria, will admit it in OPD SAM. And if the assessment output is not meeting the IPD SAM and OPD SAM, and have at least 1 or more of the following these signs, which you can see in MAMI outpatient, we will admit that infant to our MAMI outpatient, which is going to receive the first of all, it will again, we will have some assessment to identify the root cause and the needs. We'll provide individual counselings, breastfeeding practices, and also growth monitoring for until the infants pass that risks and become normal, meet the normal criteria of this assessment. This is the adapted MAMI care pathway, which is 3 pathways. Next slide. Yeah. MAMI is an extra layer of prevention. How we adapted in IMAM guideline, we have IMAM integrated management of acute malnutrition, as you all know about that. We adapted this MAMI approach on MAMI care pathway to our IMAM guideline. Every infant with when they are reaching to our health facilities, we are conducting assessments. If they meet the OPD SAM, will admit it. If it has that infant has complications, plus plus that criteria of OPD SAM will refer. And if they are not severe acute malnutrition or severe acute malnutrition plus complication, but still have some risks, of course, MAMI risks will admit it to the MAMI outpatient, which you can see that MAMI risk factors that low birth, premature birth, moderate, mild feeding difficulties, like this signs. If the infant have this signs, or we found this signs to an infant, in order to prevent an earlier stage of going to malnutrition, the MAMI will support the child and mother to be safe from future malnutrition problem. Yeah, next. The pilot of this MAMI approach, the process was the MAMI approach integrated to our routine health and nutrition intervention, our health facilities through static health facilities or MHT MHT facilities. It's conducting, but it's conducting by trained nutrition nurse in each of our health facilities. Then responsible person is nutrition nurse conducting the assessments and this and filling the and follow up of this process. We have started with some steps which we have followed. First of all, we capacitate our we conduct the capacity building for our frontline health workers. We provide the training. Then we integrated this MAMI approach to our to our existing interventions, health nutrition interventions. So after that, we started full assessment and registration. It's by our nutrition nurse for every infant visiting our health facilities. After that, assessments identifying at-risk infant mothers and peers. Then after identifying, we will provide the support like individualized counselings and follow-up. And also we closely monitor that the outcomes and the trackings, which in next slide I will show you the treatment cards and follow-up cards. Sorry. Piloting MAMI, these assessments include infant nutritional status, which has the signs and criteria which we are doing by the assessment, and infant clinical condition. First, infant nutritional status. Then second, we are going to assess the clinical condition of that infant, and third, we will check the MAMI specific risk factors on that infant. In fourth step, we will assess the feeding practice of that infant, and at the end, the fifth, we will assess the maternal mental health, like mother mental health. Assessment components are these 5 things, which is included in one assessment cards and form, which in next slide you can see. Yeah, next slide, please. Yeah. You can see here the care pathway, the complete assessment. You can see the form which developed by our team. This at the first infant will our colleagues will fill out this form with that infant. This is an assessment form. After completion of assessment, at the next step, we will decide on management in which pathways, on which care pathway we should start with this infant. At the next stage, we will provide support if the infants go to outpatient MAMI care. We will provide supports, breastfeeding counselings, and IOA safe counselings like growth monitoring and follow-up. And at the fourth step, you can see the monitor and follow-up on support until 6 months of age. You can see here a follow-up card, which is going to be filled in each visit of that infant to our health facility, which include 10 visits. In the left side, you can see that indicators and the signs of and criteria of each component of that assessment, which is clinical assessment, nutritional assessment, the MAMI risk factors, and maternal mental health. You can see we are assessing in every visit that infant, that in order to see or track the improvement of that infant in under our treatment. This was the care pathway and the forms and cards which we are using. Next. Yeah. Since 2021, from 2 health facilities which we are providing this MAMI approach to under 6 month age infants, we have screened 2,785 under 6 months infants, and we enrolled 416 infants in MAMI program. 27 infants were close to recovery or close to cure criteria, but exited early due to that BHA closure of BHA project, as you all know about the US fund ban. And also, unfortunately, 21 infants did not meet the discharge criteria before the project ended. Again, this this BHA project. So hopefully we successfully recovered 368 infants from our MAMI program. So this is the outcome from bulk province of 2 health facility. Of course, we have a different number from all of our provinces and health facilities, which are providing this MAMI. Thank you. Next slide. Okay. You know, every new approach has some challenges in a new context. So we had some challenges regarding piloting this MAMI approach. The first was community interest, low community interest due to not distributing any nutrition communities. As you know, the MAMI is only providing counselings, regular follow-up, monitoring, good monitoring. So at the first, we faced this challenge, but unfortunately, we try our best, and we have we started community sensitization. We used our channels like Health Nutrition Promotion Committee meetings, and we sensitize the community about this MAMI approach and the benefit of this MAMI approach. As well, the another challenge was many families lack of information about the program long-term benefits, which again, we in our sensitization we try our best, and nowadays this completely has the changes has come, and we have good acceptance on regarding this approach. at the first, again, we faced stigma and misconception affected the acceptance of maternal nutrition support in Afghanistan context. In very hard to reach areas, and the areas which we are working, still it's still there is some stigma and misconceptions, but at least we tried our best to change this stigma and misconceptions in our targeted areas, which was positive. And nowadays, day by day, we can see the changes, and people are they are interest. We found that they are now interested on this approach, that they are very happy to in early detection of malnutrition, or early receiving the preventive services from this approach. Another challenge, it was like maybe it's managed. We have managed, but it's manageable. Health staff force a high workload managing integrated services, as it's a new approach. We trained our nutrition nurses. Still, it has a lot of documentations, extra working needs. So a little bit workload has come to our staff routine workings tasks. So we somehow managed. We have hired we have hired another staff to support the nutrition nurse to cover this MAMI approach, nutrition counselor. So now these issues solved, and they are together working on this approach, nutrition nurse and nutrition counselor. The another challenge is, maybe this challenge is common with all components of health and nutrition. The referral system for also for mental health and clinical issue, it was somehow weak. Still, it's in some areas it's weak. So we try our best in order to strengthen these referral pathways. We started our community sensitization regarding that early detection of early detection of in other intervention, early detection of malnutrition cases. And we try our best to strengthen the referral system. In BHA project, we were providing some transportation costs for them in order to strengthen this referral, because in Afghanistan we are working in very hard to reach and remote areas. The transportation facility is not available. They are struggling with these challenges, and regarding transportation, we try our best, and somehow we managed to change their beliefs of regarding that referral. They were not much interested in referral, which they going from one health facility to a standardized health facility, another health facility. So we try our best nowadays in our working area. This referral is good, and we can see the changes, and we have some referrals every month in our reports. These challenges was maybe partially we or for some of them completely we addressed these challenges, but I wanted to present here because maybe every new program has these challenges. Maybe it will be common in other countries as well. In next slide, we will have some recommendations. Yeah, we are recommending to increase community awareness, raising about the importance of these MAMI services, and train the local health workers and community leaders to share the key message with the families, with their communities, because it's very important. If the change in like Afghanistan context, the changes will start from the local elders or leaders or community leaders and religious leaders. If we start awareness raising and train them, then it will automatically make easy our life to sensitize the community. We recommend to include MAMI activities as a part of existing nutrition, maternal and child health services. We advocate somehow for this in every platforms like nutrition cluster, national nutrition cluster, and with our respective public health ministry. So and another recommendation is to create simple and clear tools in local language to help staff to do their work more effectively, as it was our lesson learned from our pilot. Encourage health authorities to include MAMI services in routine health package, like we have in Afghanistan, BPHs, EPHs, and other packets of health nutrition interventions. It should be included, because it as we based on our experience, it was very helpful to decrease the number of malnutrition cases and the mortality and morbidity, mortality of rate of malnutrition cases among under 6 months of children. In these two districts, we can see the difference between another health facilities, that the number of by passing the time, the number of malnutrition cases effectively decreased in the targeted areas of these two health facilities targeted area. So we are advocating for them for this to be to be included in our other health nutrition package as well. Yeah, and the next slide about the advocacy, what we have done. We have presented this MAMI to IMAM Technical Working Group on 2021, and before starting this, and somehow it was interesting for them. So still we in 2025 this MAMI approach included to nutrition and emergency by nutrition cluster team. I think Hedwig's in picture, and also our cluster colleagues as well. Still, we will try our best to advocate for this new approach, which is differently, which is very helpful, and to prevent the malnutrition among the under 6 infants for now, and in the future of that infants which more than 6 months, which under 5, totally in under 5 age children. It will help to decrease the number of malnutrition cases and decrease the gum rate among the communities. Thank you so much. In the next slide, it was unfortunately we didn't put the more picture on this slide. In next meetings, of course, we'll have more pictures and more experience sharing with you in this platform. Thank you so much for your attention. I'm happy to take any question or hear about your own experience implementing MAMI, or like, yeah, thank you.